Well, good morning. Thank you for joining us today. I'm speaking today from the traditional territory of Treaty 6, and I acknowledge the Métis people who share a special connection with this land. Today is a great day for all Albertans who depend on the insulin pump therapy program. The UCP's decision to completely reverse their planned cancellation of this essential coverage is only possible because of the thousands of Albertans and diabetes advocacy organizations who spoke out. Albertans wrote to the Minister of Health, they wrote to their MLAs, they went to the media, they shared their stories online, and they joined us in the opposition to speak about the importance of the insulin pump therapy program. And they were clear. Insulin pumps are life-saving and life-changing for people with type 1 diabetes. And with the rising cost of living, there could not have been a worse time to cancel this program. Yet that's exactly what the UCP had planned to do. Their cruel, short-sighted decision impacting those who rely on the insulin pump therapy program shows just why Albertans simply cannot trust the UCP when it comes to their health care. Let's run down the timeline. First, on May 2nd, the UCP canceled the program via a press release, hiding behind the claim that it was necessary to make newer technology more accessible, when the truth was there was no reason why the program could not be expanded in its current form to use more and newer technology, which the UCP finally came out and admitted today. On May 9th, I was proud to join over 25 Albertans with diabetes to call on the UCP to pause their cruel plan and enter actual consultation with the diabetic community. 3 days later, the UCP announced that they would do just that. However, in the end, they only held one public consultation over a telephone town hall, which was heavily criticized for pushing the UCP's original plans to cancel the program and that shared outdated research about the effectiveness of pumps. That, in turn, caused more anxiety within the diabetic community. Following that, I was proud to join a family doctor who has 2 children with type 1 diabetes to share her concerns about the consultation process and call on the UCP to provide a real plan for talking to and hearing from Albertans. A few weeks later, on June 27th, we shared that the UCP had met with the diabetes technology company in September of 2021 to talk to them about making changes to the insulin pump therapy program, but not with the people who actually use the program. And this again shows just how out of touch this UCP government is and why they must continue to be held to account. The UCP must release more details on who will be on the diabetes working group and ensure all Albertans with diabetes are heard. Unfortunately, we've seen the UCP prove time and again that Albertans simply cannot trust them with their health care. And indeed, we don't even know if Minister Copping will be the health minister come October. So frankly, the only way to ensure that Albertans with diabetes and all Albertans have the same access to health care they have today, the support that they need when and where they need it, is by electing an NDP government. Thank you, and I'm happy to take your questions.
All right, we'll start with questions here on location, but if you are on the Zoom or phone, please use the raise hand function or *9.
So what are you hoping to see from the working group itself?
So certainly what we saw the minister finally admit today, and what he should have realized all along, is that investments in preventative care can go a long way to saving costs in the healthcare system and indeed providing a better quality of life for Albertans. So now that he's learned this lesson, what I'm hoping to see from the diabetes working group is the government actually come forward with a real plan to live up to that. So what we saw is that the government chose to rush ahead with a very ideological plan, very short-sighted, without having listened, and we saw the incredible potential damage that could have done, the pushback. So what I really want to see from the diabetes working group is folks with the lived experience, folks from advocacy organizations. Would love to see some folks from the medical field who work with these individuals and provide them with the crucial support that they need in the healthcare system. From that, I'm hoping we're going to see some very clear recommendations on how we can invest better to support these folks, make more technology available to them to help protect their health.
And you had mentioned that, well, this report is not coming out till fall 2023, so it's possible there could be another government. Would you commit to implementing any recommendations this working group may come up with?
So certainly the commitment we've made already as the Alberta NDP is that absolutely we will keep and protect the insulin pump therapy program. We committed that we would have real consultation, listen to folks in the diabetic community and other health experts to determine how that program can be expanded. So certainly that is the intent of the working group, and certainly we will then be happy to take any recommendations that they bring forward and look at how we can implement those to support Albertans living with type 1 diabetes.
And some of those new pumps require a continuous glucose monitor in order to work effectively. Some of the new pumps that will be covered, would you cover the glucose monitors as well?
So we know that the continuous glucose monitors are covered for those up to the age of 18 currently. Of course, not being the minister and not being in his place, I don't have access to all of the data and all of the numbers that the minister does. Certainly what I'd say is we would certainly, I think, as a government be open to sitting down and having that conversation. We know the value and the support of this. The question is then, what are the costs and how do we work that into our public health care system?
All right, we'll now go over to the Zoom, and Tom, your line should be open.
Hi, David. Thanks for taking my question. I'd like to get you on another topic if I can. One of my colleagues in Calgary is working on a story about the Airdrie Community Health Centre. The Urgent Care Centre was just announced that it's going to have overnight closures on Friday, Saturday, and Sundays for the next 8 weeks due to gaps in physician coverage. We saw a lot of this last summer as well. Are you seeing any improvements in the situation when it comes to healthcare staffing and being able to keep facilities open?
I'm sorry, I just missed the first part of that question. Am I seeing...
So are we seeing any improvements from last summer? This was a big problem last summer as well. Are we seeing any improvement this summer, or are we still stuck in the same position we were last year?
So I did hear this morning about the closure of the Airdrie Urgent Care Centre, weekend evenings through the end of the summer, for 8 weeks, I believe. Deeply concerning to hear. We've been hearing from, I met with folks in Airdrie last week to sort of talk about the concerns they've been raising, the incredible pressures their services were already under, and now for weekend evenings, those folks are going to be forced to drive to Calgary, where we also know they are continuing to see soaring wait times and increasing pressure in emergency departments and other areas. So is this better than last summer? I don't see how it possibly could be. Indeed, we saw this crisis begin in May of last year. We started flagging it to this government in the House, on social media. We began calling on them to take action. They denied the problem existed. It wasn't until the end of July of last year, in the midst of their best summer ever, that they began to acknowledge the crisis we saw building in access to care, particularly in areas outside our urban centers. And that problem has only compounded since. We see wait times continue to rise. We see more and more situations where there simply aren't doctors available. We see continuing closures in areas across the province. This is a crisis of this government's making. I know that multiple jurisdictions are facing pressures right now, but in Alberta it has been made far worse by a government that has chosen to fight with doctors, fight with frontline healthcare workers, and cause unending chaos throughout our healthcare system in the name of their ideology. So it's really my hope that they'll take some time away from their obsession with their own politics and leadership race this summer and take some actual action to support Albertans like folks in Airdrie.
Do you have a follow-up, Tom?
So what are some actual steps in the short term that you could see that could minimize closures like this?
So certainly we know that some of the pressures in EMS are leading to more pressures on hospital. So we've laid out some very clear steps the government could be taking, whether that's moving more casual paramedics onto full-time work where they have more stability and benefits, addressing issues like the opioid crisis. They could reopen some of the supervised consumption sites they've closed, and we could see them take some action to support things there. Certainly we need to see better support for our healthcare workers. The fact that they continue to leave doctors in the province working without a master agreement is part of what's led to some of the emotional exhaustion and the frustration and made it much harder for us to recruit folks into the province. The government could take action on addressing that situation. And those are some of the, I guess, some of the preliminary steps. Really, frankly, it comes down to recruiting and supporting the workers that we have.
And did you have a follow-up, Tom?
No, I'm good. Thank you.
All right, we'll make another pass for questions. Oh, and let's go one more in person here.
Yeah, since you mentioned the UCP leadership race, Danielle Smith has proposed a pilot of having a $300 health spending account so people can spend it on things like counseling or physiotherapy. What do you make of that proposal?
Well, first thing I would note is that Ms. Smith is running to lead a party that has undermined Albertans' access on so many of those fronts. This government made changes to access to physiotherapy in the system, making it harder for Albertans to access through the public health care system. Our caucus, we have put forward a proposal in the midst of the pandemic that every Albertan should have access to 5 publicly funded mental health care sessions. Instead, what we're seeing from Ms. Smith is the kind of pattern that we continually see from Conservative governments, where they attack and undermine and, frankly, destroy parts of our public health care system so they can turn around then and look for private alternatives and suggest that people should not be accessing services that are publicly funded directly. So certainly if Ms. Smith wants to see that Albertans can access more services, I suggest that she look at the deep damage her party has done to our healthcare system and how they can begin to undo that.
All right, and seeing no more questions, that will conclude our press conference today. Thank you, everyone.
Thank you so much for watching, and to learn more, check out albertasfuture.ca.